Good evening. Welcome to Ask the Expert, presented by Mary Washington Healthcare. Tonight's session is the last of a four-part series featuring heart care professionals from Mary Washington Cardiology. During this session, our experts will discuss heart-related issues and topics that are specific to women's cardiac health. This program is called Ask the Expert, so of course, we will answer your questions live. Our providers want to hear from you. To submit your question for our panel, simply drop it in the chat here on Facebook. Today's panelists have a wealth of experience in cardiology, and they are truly experts in their field. Let's meet them. First, we have Dr. Anna Tomdio, a cardiologist with Mary Washington Cardiology. She is a cardiovascular disease specialist and interventional cardiologist, skilled in the disciplines of cardiomyopathy, high cholesterol, and diabetes. She specializes in treating heart attacks, congestive heart failure, and valvular heart disease. Dr. Tomdio is certified by the American Board of Internal Medicine in cardiovascular disease and internal medicine. She is also a board certified diplomate of adult comprehensive echocardiography, and she's a fellow of the American College of Cardiology. Next, we have Sherry Deneke, a clinical exercise physiologist in the Mary Washington Hospital Cardiopulmonary Health and Fitness Department. She provides cardiac rehabilitation for patients who have suffered a cardiac event. Sherry focuses on educating patients about stress management, nutrition, risk factor modification, benefits of exercise, and medication management. So welcome everyone, and thank you for joining us tonight. We're going to start the program by answering a few commonly asked questions that our providers often hear in their practices. Dr. Tomdio, let's start with you. Can you share with our community the different kinds of heart issues that women face versus men?
Yes, absolutely. So some of the things that we see more commonly, and I will start with the younger population, are those who are pregnant, and you have what we call gestational diabetes. You have patients who get hypertension while they're pregnant. And these are all important things that we have to keep in mind, because those that do develop that end up are at higher risk of cardiovascular disease later on in life. So that's one thing that makes it separate from men. Something else that's a little bit more common is what we call microvascular disease. And there's some specific testing that gets done for that. This doesn't mean that men do not get it at all, but women are just more at risk or have it more often than men do. So those are two that I would mention for now.
Great, thank you. That's a great way to get us started tonight. I'm sure that we have a lot of women who are in the audience tonight and watching and very eager to hear what you both have to say. Dr. Tomdio, for you, what advice would you give to a woman who is looking for a cardiologist? She's never been to one before. So when should a woman look for a cardiologist, and what kinds of questions should they ask? What kind of experience should they look for?
Okay. So women, I'll say this for everyone in general, but specifically since we're focusing on women today, what you want to look for is, first of all, someone that you will be able to trust. Unfortunately, you're not going to know that until you've actually met them. But I think that if you're at this point where you're seeing a provider, you've had enough experience where once you meet that person, you either feel at ease with them or you do not. And so that's one big thing. You want to make sure that you trust whoever you're seeing. The other thing that you're looking for is, when you are making an appointment with a cardiologist, you're coming with specific concerns or specific questions. So you want to make sure that when you're seeing them, you can ask them, are you experienced in this area? And a lot of cardiologists are, especially general cardiologists, but there are some that are just more experienced in specific topics or specific diseases. And those are things that you can ask during your clinic appointment. And if they're not, they'll be honest and tell you, and then you can feel free to find another one or ask them if they can refer you to someone else. But those would be the top two things I would say.
Great, thank you. Sherry, let's flip over and talk with you a little bit about your specialty, cardiopulmonary rehabilitation. What kind of diagnosis does a person need to come see you and your team? And do they need a physician's referral to come see you?
Yes. So anybody who comes into cardiac rehab definitely has to come with a physician referral. And Medicare has 6 specific diagnoses that they will accept for coverage. Commercial insurances are a little bit broader, but those 6 are a heart attack, chest pain or angina, open heart surgery, heart failure. And with heart failure, there's a few little caveats, like your heart has to be at 35% ejection fraction or less. So it has to be pretty significantly declined before it'll cover it. And you have to be on maximal medical therapy for 6 weeks, and you can't have any procedures planned in the next 6 months before they'll let you come in and actually get coverage. And then also valve replacements or repairs are covered, and transplants, heart transplants.
Wow, so you're seeing quite a range of patients come
Yes,
through your practice.
definitely.
Great, thank you. One thing that we talked about during our prep session tonight that caught my interest was enhanced external counter pulsation. Sherry, what is that and who needs it?
So it's actually a procedure that we use for patients who have chronic chest pain to the point that they really can't exercise, that it's hindering their activities of daily living. They get it all the time, every day, and they're using a lot of nitroglycerin to try to control it. If they're having that much chest discomfort and they really can't exercise in cardiac rehab on our treadmills or our bikes or our recumbent steppers, then that would be a referral to that, just so that when they do that, it's a little more intense. It's 5 days a week instead of 2 or 3 days a week. And it's for 35 sessions, 7 weeks straight, 5 days a week. They lay on a table, we put cuffs around their legs, and it really helps push the blood back up to their heart. And by doing that, it improves the blood flow by helping our body to grow new blood vessels. So you have more blood vessels, therefore more blood. You have less angina, you have more energy, you have a better quality of life. And then we can transition you into cardiac rehab and continue with getting those same benefits.
Great, thank you, Sherry.
Yeah.
All right, so we have a question from our live audience. Dr. Tom Dio, I think this is meant for you. We have a member of our audience wondering when they should be concerned about an ascending aneurysm.
So an ascending aneurysm is, for those who may not know what this is basically expansion of the big artery that comes out of your heart. I'm assuming they're talking about the aorta, the ascending aortic aneurysm. And when it starts dilating, and you worry about it depending on if you have some kind of connective tissue disorder, underlying connective tissue disorder, which whoever you're seeing would have looked into it already. And you start worrying about having it replaced depending on what size it is, based on whatever connective tissue disorder you may have, if you have one. So it ranges anywhere from 4.5 centimeters to 5 to 5.5 centimeters. The other time you start worrying is if that aneurysm is causing one of your valves to leak, your aortic valve, and if it's leaking a lot and causing your heart to get bigger, then that's also concerning. So those are the times that you should definitely be seeing someone for it, and they'll be monitoring it. But those are the things to keep in mind.
Great, thank you for that information. Love to see those questions coming in from our live audience, so keep them coming. We were talking earlier today about primary and secondary preventions of heart disease. And Dr. Tom Dio, I'm hoping that you can start us out with what that means and what advice you give to your patients.
Absolutely. So primary prevention is you're a normal person who walks into the office, say, hey, I just want to make sure I'm okay. Can you check things and stuff like that? So that would mean checking your blood pressure, checking your cholesterol, screening you for diabetes. And if you do have any of those, making sure that those are treated. Other big factor is obesity, and extensive counseling with obesity, exercising, which Ms. Danikin can talk about extensively, exercising and trying to modify those risk factors. That's all primary prevention. And those are all the first things that we can do to try and be healthier, and prevent having cardiac disease later on, or cardiovascular disease later on in life. Secondary prevention occurs when we've already had a problem and we need to try and fix it or modify things so that it doesn't happen again, or prevent things from happening again. And it will fall along the same lines of, is your blood pressure adequately controlled? So for someone with a really, with an aneurysm, for example, ascending aneurysm, blood pressure has to be very well controlled and very tight and very strict about it. So things like that. So primary prevention, you haven't had an issue yet. We want to make sure everything is okay. And if there's a problem, we address it. Secondary is we've had a problem and we need to try and manage it to make sure it doesn't get worse or it doesn't happen again.
Great, thank you, Dr. Tomdio. So Sherry, welcome back. You're there a little bit later than usual, and looks like someone shut the lights out on you. So welcome. Glad to see you back in the light. Sherry, from your perspective and the work that you do with patients, how do you address primary and secondary preventions of heart disease?
Well, the majority of what we do is secondary prevention because somebody has already got a diagnosis by the time I get to them. So with all of that, we do education with all of our patients. We have classes that we actually have online now. So on the Mary Washington website at heartandlungs.mwhc.com, it'll take you directly to our links to all of our videos. And there's a video on nutrition. There's a video on benefits of exercise. There's a video on stress management. There's a video on cardiac medications, risk factors, and also one on pulmonary disease and medications. And we've had all of our multidisciplinary team here. They've taken their little piece of expertise and they're the ones who have done each of the videos. And we've reached out to other departments. One of the dietitians in the nutrition department here at Mary Washington has done the dietary one, and one of the pharmacists have done the cardiac medications class.
Right, thank you. And you made a great point, Sherry, that our website, mwhc.com, is a great resource for patients and members of our community to find resources to help them stay healthy.
Yeah. And they're free, they're open to everybody. So we tell all of our patients we want their family to watch them too, because they're part of their care.
Absolutely. It takes a village sometimes, right?
Absolutely.
We have some questions in the chat tonight about medications. So Dr. Tomdio, maybe you can help give our audience some guidance on medications. For example, do all women with high cholesterol need to take medication?
So no, it's really hard to say all or always. So it's very individualized, and it really depends on the risk factors that particular woman has. So someone who has a strong family history of coronary artery disease, for example, who may be obese, who may have diabetes, is at higher risk of having coronary artery disease or having some kind of cardiovascular disease. And that person needs to be on medication, should be on medication, versus someone who may be a little overweight with no family history at all, no hypertension, nothing else, and cholesterol is on the higher side. We'll typically first recommend exercise, making dietary changes. And if that doesn't work and the cholesterol is still high, then we'd recommend starting medication. So it really depends on who we see and what the risk factors are and whether they're diagnoses.
Great, thank you. And as a follow-up to that question, you know, when a patient, and in this instance, a female patient, is on medication, whether it's for cholesterol or high blood pressure, is there a way for that patient to get off of that medication at some point?
Absolutely. So a lot of people think that once they start medications for cholesterol, they think that they can never get off of it. There are some patients who I tell, yes, you're never going to get off of these medications in a specific group of patients. But there's some, if they are on the medications and they make significant lifestyle changes, weight loss, drastically change their diets, exercising, they could potentially come off.
Great. Well, that's good news that there's an opportunity there to get off that medication if they don't want to be on it.
Yeah.
We have a couple more questions coming in from our live audience. Love to see these coming in. Dr. Tom Dio, I think this one is for you. A member of our audience is asking if PVCs or PACs are a concern. Can you talk to us a little bit about what those things are?
Yes, so our heart has 4 chambers. There are 2 top chambers and there are 2 bottom chambers. The top chambers are called atria, the bottom chambers are called ventricles. PACs are extra beats that come from the top chambers of the heart. PVCs are extra beats that come from the bottom chambers of the heart. A lot of times, all of us at some point will have some extra beats coming from either the top or the bottom at some point. It depends on when we start worrying when the burden is high. So burden meaning there's a certain number of beats that we're looking for that you have within 24 hours. And if that number is high, then we worry and we talk about being on medications for it. And in order to diagnose that, we'll have to put a monitor on you so that we can get a number and then go from there. But if it's under good control, then we typically don't worry as long as it's well managed. If it is high and it's well managed and the numbers go down, then that's a good sign. But again, depending on how high those numbers are, specifically for the bottom chambers, those PVCs, sometimes we have to make sure that there's no underlying blockages in heart arteries. So that's something else we test for.
Great. Thank you, Dr. Tom Dio. We've got a couple more here in the live chat. Someone is asking about the difference between valve prolapse and regurgitation.
Okay. So valve prolapse means that one of the leaflets from your valve is typically the mitral valve. It's bulging into the atrium, that top chamber that I was talking about, more than usual. Normally it shouldn't, but sometimes that could happen. It's sometimes associated with having regurgitation, meaning leaking valve. And what that means is that instead of blood flowing from the top chamber into the bottom chamber, most of it does, but some of it may go back into that top chamber. And that's what regurgitation means. So having a mitral valve prolapse does not always mean regurgitation. You'll have to get an echocardiogram or the ultrasound of your heart so that we can see if you have any regurgitation. And for you to be diagnosed with a mitral valve prolapse, you would have had that ultrasound anyway. And so that we will be able to see if you have regurgitation. But those are 2 different things.
Thank you. The questions just keep coming in. Dr. Tom Dio, there's a question out here about calcium score. Can you tell us what calcium scoring is and what the numbers mean?
Yes, absolutely. So calcium score is a CT scan that you'll get. And what it does is, just to say it in the plainest forms, when a radiologist looks at it, it's definitely not how it's done, but I'm just trying to simplify it to make sure everyone understands. When a CT scan is done, if the radiologist see, oh, there's a speck of calcium here, they'll give it 10 points, for example. Oh, there's a ton more over here, they'll give it 30 points. And then they add that up to see how much calcium you have building up in your heart arteries. There's certain numbers that when it's less than 100, we're not as concerned, but I mean, it's still showing that you're having some plaque that's building up in your heart arteries. 1 to 400, we're a little bit more concerned. Greater than that, it's of high concern, and we're a little more aggressive with you, meaning being on cholesterol medications, taking an aspirin. And in a lot of instances, we'll do a stress test to make sure that there isn't an area of your heart that is not getting enough blood perfusion because of that calcium building up. But that's, in a nutshell, that's what a calcium score is.
Great. Thank you. Let's switch gears again and talk with Sherry a little bit more about exercise and the importance of exercise. Sherry, what are your general recommendations in terms of how often and how intensely someone should be active in a day, a week, a month?
So the American College of Sports Medicine recommends for everybody, whether you have heart disease or lung disease or you're pregnant or kidney disease or whatever, that you get at least 150 minutes of aerobic exercise per week. So that's 5 days a week, 30 minutes. And it can be as simple as a walk, a nice brisk walk that you can still carry on a conversation. and it's enjoyable. It doesn't have to be, like a purposeful, really excessive exercise. You just need to move. And we would want you to, keep track of that. If 5 days a week is too much, then they do give it a little leeway and they say, okay, 3 days a week, but 50 minutes with a little more intensity than you would on the 5 days a week. So that's what the American College of Sports Medicine says.
Great. Thanks, Sherry. And just to add on to that, is there any additional guidance that you might give to women over 60 when it comes to exercise?
Well, what I always say is listen to your body. Always listen to your body. And if it feels like it's too much, it's too much. And feel free to back off and do something that's a little more comfortable, whether it's walking hurts my knees, I'd rather bike. Bike. It's okay. But also, especially women over 60, you want to get in some strength training, because that strength training is going to increase the density of our bones. And we all know that as we age, our bone density decreases and does put us at increased risk for fractures. So if we're going ahead and we're doing some strength training, and that would be like twice a week, 2 to 3 times a week, then you would improve the strength of the bone, which would decrease your risk for fracture if you did have a fall.
Awesome. Great advice.
Yeah.
Thank you, Sherry.
Yeah.
Dr. Tom Dio, we've got a couple more questions in the chat here that are a little specific, but I think that we can work these in tonight. There's a question about gestational hypertension. So someone in our audience is postpartum and wondering if it's common for gestational hypertension to stick around for a long time. Do you have any experience there that you can share with us?
Yes, so it definitely can happen. Some after they've had their baby delivered a little bit past the 4th trimester, some may have a little better regulation of the blood pressure and may be able to come off of medications, but unfortunately a lot of women do not. And I'll talk about gestational hypertension. I know the question was for that, but that also includes gestational diabetes, where after pregnancy, the diabetes, your A1C may get better and you may be able to come off of medications, but both of these increase your risk of cardiovascular disease later on in life. So it's definitely something that has to be addressed. And even if you do come off of medications, it's something that you have to keep in mind and keep frequently monitoring with your yearly exams or every 6 months. However often you're seeing your provider and making sure that those are checked and addressed. But yes, it is possible that even after pregnancy, that elevated blood pressures stick around.
Thank you. And would you recommend that patients in those scenarios see a cardiologist? Is it okay for them to stick with their primary care physician?
It's okay for them to stick with their primary care physician, because the primary care providers can manage hypertension and diabetes. I would certainly say that if you start feeling that there's something else going on, more fatigue than usual, some chest pain, shortness of breath, other symptoms that are a little different than your usual, then you should definitely seek out to seeing a cardiologist.
Thank you. And one more question for you, Dr. Tom Dio. And this is around family history. So if somebody has a family history of cardiac concerns, whether it's heart disease or a heart attack, when should that person potentially start seeing a cardiologist to make sure that their heart is healthy?
The earlier the better. And I would say that because if there's, depending on what this family history is, how extensive it is, we may be more aggressive with treating cholesterol, treating hypertension, counseling about weight loss, counseling about exercise. And so I would say the earlier the better.
Thank you.
Yeah.
We are coming up towards the top of our time, but we do have time for a couple more questions. So one question that I have for both of you is around diet and what is a good diet. And maybe for fun, each of you can share your favorite heart healthy snack. Dr. Tom Dio, we'll start with you.
All right. So a good diet, I'll start, and I'm sure Mr. Anike would say the same, is what we recommend is the Mediterranean diet. A lot of folks, unfortunately, when you try to lose weight, some of our patients will get on these quick diet for a quick fix, but it's not sustainable. You may lose 20 pounds in 1 month, but one, that's unhealthy, and two, is just not sustainable. And so the important thing, and one thing you have to remember, is being able to do everything that you see that you'll be able to do for the rest of your life. So that's one thing. And the Mediterranean diet is huge with that, which means olive oil, unsalted nuts, which is my favorite snack, olive oil, fish, being careful with seafood, because things like shrimp and things like that are high cholesterol, have high cholesterol content. So you want to be careful about that. Salads, feta cheese, things like that. So that's the one that we always recommend.
Great. Thank you, Dr. Tom Dio. And Sherry, what about you? What advice do you have, and what's your favorite heart healthy snack?
So I totally agree with Dr. Tom Dio that it should be on the line of the Mediterranean, whole fruits, vegetables, whole grains. Those are the things that, if it's white, you want to eat less of it. Make your rice and your breads brown. And the more liquid that you can have in your food, and the more fiber that it has, the better it is. And it's going to help you fill up, and it's going to be more beneficial to you in the long run. One of the, there's this website called, gosh, I just lost the name of it, but it's 75% of your plate should be the high fiber, high liquid foods like beans and the vegetables and the lettuce and all that stuff. The less liquid, even though they're good for you, would be the brown breads and that sort of thing. They're not as high in liquid. So those were the things that you would want to think less of. But my favorite snack would be like fresh fruits, strawberries, blueberries, those sorts of things are great.
That's so true, especially in the summertime, right? That sweet, sweet watermelon. I'm so excited for it.
Yeah.
And just to piggyback on that, sorry, when you go see your provider, a lot of the offices have handouts, they have little booklets, they have little things that they can give you, so you can take home and read with you. You can also find it, on the internet. If you just type Mediterranean diet, you'll be able to find a ton of great recipes for that. But if you don't have access, or you're not as comfortable, or, when you see your provider, they can certainly hand you something about a Mediterranean diet.
Yeah, that's great advice. Thank you, Dr. Tom Dio. One more question that's come in from our live audience. Dr. Tom Dio, I think this is for you. Wanting more information about if there's a relationship between sleep apnea and heart disease.
Yes, there is. It's been proven several times. One, sleep apnea, uncontrolled sleep apnea has been shown to increase the rates of those top chambers of the heart that I was talking about, the atria, arrhythmias there. It causes pulmonary hypertension, so elevated pressures in your lungs, elevated blood pressure as well. And so it's crucial, no matter how mild, so it's just mild sleep apnea, it should be treated. There's certainly a correlation, certainly an association, and you definitely should not ignore that.
All right, good advice. Thank you. Well, we are at the top of our time. I have just one final question for each of you. There may be some folks out there wondering why we would dedicate an entire session of Ask the Expert to women's cardiac care. And I think our audience would love to hear what it means to you to help women take care of their hearts. Dr. Tom Dio, let's start with you.
Yeah, so it's very unfortunate that only 45% of women in the United States know that 1 in 3 women will die from cardiovascular disease. So it's more rampant than breast cancer. And less than half of the women in the United States know that. And it's a problem. And the studies that we've had were mostly with men in them. And for a long time, it was a man's disease. And that's not the case. And the problem is that a lot of women, unfortunately, would present with very atypical symptoms. The men will usually come in and say chest pain, most of the arm, throwing up, passed out, very short of breath. Women may just have something that feels a little bit like indigestion, or they're more fatigued than usual at the end of the day. So it's very different symptoms. And it's unfortunately, it's looked at sometimes as, oh, maybe you're just a little tired, or anxiety, or things like that. And so do not ignore your symptoms. You should see someone. Ask your primary care provider, ask your cardiologist, and especially if you have risk factors, you are including family history, you're at higher risk. So you should not be ignored. So.
Great. Thank you, Dr. Tomdio. And then Sherry, for you, tell us what it means for you to help women take care of their hearts.
Well, everything that Dr. Tomdio said is right on target. And I see it every day. And what I always tell my ladies in rehab is sometimes they give the excuse of, well, I have to do this for my family. I have to do this for my husband, my kids, whatever. And I always say, you have to take care of yourself too. As caretakers, traditionally, we think about everybody else first, and then we always come last. And at some point, it's going to get to the point where you're not going to be there to take care of them if you don't take care of yourself and make time for yourself to exercise and eat right and do some deep breathing and stress management so that you can stay well and be there for them.
Wow, that's amazing. Thank you, Sherry. I love those comments to close us in this program for tonight. I want to share my deep thanks to our panelists for sharing your time and your expertise. And I do want to give a very special shout out to Sherry, who recently celebrated 35 years of service at Mary Washington Healthcare. So Sherry, thank you for all of your contributions to our health system and our community. We appreciate you.
Thank you so much.
And of course, we thank you, our viewers, for tuning in to this Ask the Expert session. If you have questions about cardiac care or want to learn more about our services, we invite you to visit our website for additional resources. You can find us online at heart.mwhc.com. And be sure to watch the Mary Washington Healthcare Facebook page and other social media channels to stay informed of the latest health and wellness information for our community. Many thanks for joining us this evening. Please stay safe and healthy and have a great night.
Thank you.